Hi, we're here with Carol Peterson, registered pharmacist again, and we're talking about properties of medicines or ingredients of solutions. The major problem with allergy is dose related. So the higher the doses, the repeated doses, you get the type 3 hypersensitivity.
The more severe the reaction.
The more severe reactions can occur. So dextrose, we don't use at the clinic for proliferative therapy, but it's commonly used as a prolotherapy ingredient. What problems are with dextrose, are there?
Dextrose is derived from corn, and there could be some cross-sensitivity in people who have already developed corn allergies.
Thank you. Phenol is a common proliferant used by some prolotherapists. We don't use it at the clinic. Why?
It's quite an, as you might want, it is of course an irritant, but more frequently it's used as a preservative. And preservatives are there because they kill bacteria, etc. But being a preservative and having this activity is also something that people may be sensitive to. So it's probably a poor choice of solution.
It's a known allergen, it's a known toxin.
Yes.
It's used by the Egyptians thousands of years ago as an ant killer. We don't use ant killers in our patients.
Right, but if you're buying a product that has, you can check your labels. If a product has been preserved with phenol, it's going to give you a year or 2 years that you can keep it around because it's there busy killing things.
Right. We don't want to keep our formulas at all. We want them freshly made and free of preservatives. Sodium morierate we do use, and it's a biological, and there's a plethora of different ingredients in there. It sometimes can be allergic to people, like I myself, but it's an important and very powerful proliferant. So we use that in a small number of patients. What's the problem with the lidocaines?
The lidocaines should not be a problem if you are doing solutions. And this is another place where compounding comes in. We can prepare solutions without any preservative at all. And in the low doses that are used in prolotherapy, I really wouldn't expect to see any problems. Compounding has that advantage that you don't need a long shelf life. We prepare things for practitioners to use immediately, so we don't worry about putting other things in to keep it lasting longer.
Right, so we use the compounded, preservative-free lidocaine. Is there any problem with the lidocaine molecule itself as far as sensitivity?
I would say not. It's it's not a protein in nature, which we tend to form allergic reactions to things that are protein. So I would not expect the development of sensitivities to lidocaine by itself.
Right. It's never been reported, the preservative-free lidocaine. However, how about the epinephrine lidocaine so popular with the dentist? Another formula we don't use.
Oh, okay. They're also preserved with sulfite, and there's numerous people who do have problems with these sulfur products that are also used as preservatives. And as a pharmacist, I've documented for many people that they have sulfa allergies, and they would have a big problem with this kind of product.
Thank you. So what our point is of this presentation is it's very important to know the properties of the medications, all the ingredients in the solutions, to bring about the best possible result in the patient. Do you have any additions to that?
No, it seems like you're doing the best you possibly can for your patients, Dr. Faber.
And that's what we want. And thank you for being helpful and informative.
Thank you.
All right.